The Healthy Lifestyle feature on Talk Radio 702 and 567 Cape Talk with Rhedi Thlabi.
Hands up, anybody who's not interested in that one. Are your hands going up? Hands? Anybody? No hands. No surgical, non-surgical and anti-aging treatment. Non-surgical anti-aging treatment. And at some point, we do know that the mirror does betray you. And all the years, all your experiences start being reflected on your face. It does shake your sense of youth, right? The vivid signs of aging, whether it's wrinkles around the eyes or lips, age spots, maybe some sagging skin. And there used to be a few options available for turning back the clock without submitting to surgery. But today, you can actually soften the signs of aging with a wide range of non-surgical procedures and anti-aging treatments. Many middle-aged women especially, and of course men care about this, who aren't quite ready for a facelift, are turning to non-surgical anti-aging treatments to keep them looking younger. Now, to meet the demand, new treatments are being developed every single time, which is good news for anybody who is interested. And to help us answer some of these questions, Dr Maureen Allem, founder of Skin Renewal Clinic South Africa. Good morning to you and welcome.
Hi, Rhedi. Thanks for having me on your show.
And I can testify that you've got beautiful skin, so whatever it is that you're using actually does work. Just tell us more about the non-surgical treatments. I mean, how many options are there?
Really, there's so many options, but it depends where your problem lies. Aging is a multifactorial problem, and you have epidermal problems, you have dermal problems, and then you get the loose skin in the deep dermis. So it just depends, where your problem lies and what you can see on your face.
And when we talk about the non-surgical anti-aging treatment, are we only talking about skin products?
Usually skin products, skin treatments, yes.
And what about those that claim that claim to be reversing the effects of aging, but they don't actually deliver the results? The consumer is so overwhelmed by what is out there, and you can never separate the real ones from the not so real one. How do you go about deciding which product is for you?
Really, I try out everything myself. Very often I do like an experiment on my face where I only do one side of the face.
You're brave.
And that's the best way to see whether a treatment is working. But you have to be patient, because to build collagen, you have to wait at least, collagen takes 90 days to, be produced in the skin. So you have to wait at least 90 days to see the final result.
So you do test them on yourself?
Yes, I do test all the products and treatments on myself before I,
You don't get nervous that
no, not at all.
No, come on.
That's the beauty about non-surgical treatments, because you can actually, it's all reversible, and you can actually, if anything does happen, you can actually fix it up.
I can't see any lines on your face. I cannot.
No, I'm very processed. I'm a processed little pork sausage, as I tell my patients. But now that since I've lost a bit of weight, I'm now a little processed Vienna sausage.
That is just so funny. Okay, let's talk about the anti-aging procedures. You've got what's a dermal filler?
A dermal filler is one of the amazing, I call it the woman's best friend. You have no idea what instant effects and how it changes the shape of a face. Women can see that they are, looking old. They can see the wrinkles, they can see the age spots, they can see the sagging, but they're not quite sure what is happening to their face, because slowly, year by year, they're starting to look like their mothers. And they don't realize that volume loss forms a very important part of the anti-aging treatments. And if you don't replace that volume, you're never going to have a youthful look to your face again.
Okay. And then we also have collagen stimulators, muscle relaxing agents, liquid facelifts, chemical peels, all of that. Do you have to choose one, or you can apply all of them?
Look, most women need help in all three layers of the skin. Most women have got pigmentation. Most women have got spider veins in their face. Most women have got sagging. And as we age, from the age of 14, the fibroblasts in the dermis, they're the cells that make collagen. They start slowing down. So by the time you're 28, you eventually see tiny little crow's feet developing around the eyes. And then by the age of 35, you start seeing nasolabial lines forming, because you're losing volume in the mid-face.
Yeah.
And your fat pads aren't where they should be, and they're slowly sagging down. And then you get, and from repetitive motion, smiling, laughing, you get the lines forming between your nose and your mouth.
I know I'm going to have them there.
And that's a very big problem. That's what most women can recognize. And that's the first, our most common age of a patient is 35 years old, and that's when she starts recognizing these nasolabial folds. And it definitely pulls the face down and makes the person look
tired
and, moody. So that's when we start with the dermal fillers.
Okay.
And they work their magic.
So here I am, I'm Rhedi Thlabi, and I go to one of the Skin Renewal clinics, and Thomas comes through as well. I imagine that you don't have a standard procedure for all of us. You'll be testing. What can I expect my first visit?
Look, normally I ask the patient what worries them most, and usually they say, their frown lines or their pores, and then I give them my honest opinion of what I can see that's happening in their face, and I do make them aware of what's happening. And once I've made them aware that they've lost the volume, they say, "Oh my goodness, that is what's happening to my face. I couldn't understand, why I'm looking so old." And then we do 1 or 2 dermal fillers, and they can see the instant lift that the fillers give around the mid-face.
And once you start with a particular treatment, whether it's Botox or chemical and laser peels, is that now what you're going to have to do for the rest of your life, and how often, or does it depend on your skin?
Really, all these non-surgical treatments, the trade-off is that there's no downtime, but you have to have more than one treatment. And to be honest, most of my patients, about 4% of my patients, I can perhaps convince them to have a more aggressive treatment with downtime, but most of them say, no, I don't want any downtime, and I don't want anybody to know that I'm having treatments done. They'll rather come back 6-8 times, walk out there looking fresh, and slowly see a difference than having a dramatic change and having, dramatic red faces for 5 to 10 days. They're not interested in that. So they're quite happy to do it slowly, because then people don't really notice notice what's happening. They just see that every time they see the person seems to be looking fresher and younger.
Doc,
and that's what's so great about it.
Are there people, though, who would qualify for a facelift? They've left it till late, and they would qualify for surgical.
No, absolutely.
Okay.
If you've left it till late, if you've not looked after your skin, if you've been in the sun, if you've smoked, you definitely, and if you look into the mirror and you have lots of sagging skin around your jowls and neck area and lots of fat, you definitely need to have that fat cut away. There's no non-surgical treatment that's going to give you the same kind of result. You can't. That's why the beauty about these treatments is that you come early on as soon as you see the first few signs of aging, that's when you come. You don't leave it too late. And then you do your 6 to 8 treatments to get your skin back to where it was. And the beauty about these treatments is they're actually putting collagen back in the skin.
Yeah, which is what it's about.
You see, which facelifts don't do. And they're also, they're actually putting volume back in your skin, which facelifts don't do. But even patients who've had facelifts, they can also be candidates for a bit of brightening and tightening. And they're also candidates for volume loss, because facelifts don't really address the mid-face. Facelifts don't really address the lines around the mouth.
Why do people walk up? Because I can see them when I do my shopping. And there's this particular I don't want to call her a gran, for all I know she doesn't have kids and grandkids. But there's some that doesn't look nice. Even some celebrities have, when the skin is like so tight and the lips are swollen, and it looks like if that person were to just give a slight smile, their face would just fall apart. It's so tight.
No, you see, that's the problem. That's the first question that my patients ask me. Please don't make me look like those women with those big lips. So we make sure that we don't do that.
Yeah.
But unfortunately, when we do filler around the lip for 1 or 2 days, depends, maybe even be 5 days, you are going to be swollen.
Yeah, and but it goes away,
and
doesn't
we do
it,
explain to the patients that you will look a bit odd for the first 5 days, but then it all goes back to normal. And then you're just left with a lovely natural rejuvenation of the lip.
Okay.
Which is very important to do, because if you don't, that's one area, if you leave it too late, it's very difficult to treat.
We're chatting to Dr Maureen Allem, who's founder of Skin Renewal Clinics South Africa. Any questions that you have, no judgment, no judgment. I'm a big fan of whatever it takes to make you feel good about yourself, to make you look good. And I know that there's a school of thought that says, leave it to nature, let the natural process take its course. That's your way. That's your way. But somebody else out there wants to have non-surgical anti-aging treatment. Anything you want to know about this, we'll answer your questions right after this.
The Healthy Lifestyle feature on Talk Radio 702 and 567 Cape Talk with Rhedi Thlabi.
Alrighty, so that's it then. Anti-aging treatments. We're talking about non-surgical anti-aging treatments. May sound like something out of a science fiction magazine, but they are here to stay, and they work. And to tell us about the options, Dr Maureen Allem, who is the founder of Skin Renewal Clinics South Africa. Anything that you need to know about this and what you can do. Maybe you're worried about some spots on your skin, some wrinkles, whatever it is. Give us a call on 021 446 0567 011 883 0702. And in fact, there's an SMS that's asking, Rhedi, I'm 54 years old, and fortunately I'm not that wrinkled, but I do have funny spots on my face. Can that be reversed?
Yes, of course that can be reversed. You can do it. The traditional way would be to use liquid nitrogen or a cryo-pen, but that can leave a bit of scarring. And the way we do it is to do a very focused pulse light treatment that destroys the melanin in the skin. And then another way we can do like spot treatments is by using a slightly stronger TCA peel to actually remove those age spots.
Okay, so it can be done, Michelle.
Absolutely.
Let's go to Nolene in Parktown. Hi.
Hello, hi, Rhedi.
Yes, hi.
I just want to find out. I've been to a skin specialist, right? I never use any products on my face, but I recently have developed these red blotches on my face, like on my forehead and on my cheeks. And I started using like L'Oreal products or Garnier, but it doesn't seem to help. What should I do?
What for the red blotches? You must just be careful of some of the products contain retinol, which can be very sensitizing and can actually make red blotches worse. So just be careful what the ingredients in your skincare products are. Very often, maybe you should stop the products for a while and then slowly introduce them and see if those red spots develop again.
Yeah, that would seem like the obvious thing to me. If you are attributing it to a product, then maybe stop the product a little bit and
then slowly introduce it. And if it happens again, then clearly you're allergic to something in that product.
Okay. And I mean, how much should you shop around? Because there are some people who are not necessarily going to go for anti-aging treatment, but they want whatever products that they use on an everyday basis to be the right ones for them. And you get into such a panic as a woman. I remember I announced on the radio when I turned 32 years ago that I've always vowed that when I turn 30, I'm going to use anti-wrinkle cream around my eyes. And I was inundated with emails from listeners. Which anti-aging cream are you using? I thought, no, I'm not saying anything more about this. I don't want somebody coming in and saying you endorsed a product on air and it didn't work out. But at what point do you start the more sophisticated type of products on the market?
Look, from the age of 28, you should start using a good eye cream around the eyes. The traditional products were, Retin A, and that was that surfaced in the 1980s, and it's still available today, and still does its work by recreating collagen long term and helping wrinkles. And then in the 90s, the alpha hydroxy acids came into play, and they were great also for resurfacing the skin and also stimulating collagen. Then we get all the antioxidants like the prevages, which protect the collagen that you have. They don't really stimulate new collagen. But the new technologies now are peptides and growth factors, and they are available in more expensive products, which you can get from overseas, or you can get local products. And you can even get something from Clicks. I mean, that oil of Olay Regenerous has got a great peptide in it that also works. So you don't have to spend a fortune, to make sure something works.
Jackie in Athlone, hi.
Hi there, Rhedi. Hi, doctor.
Hi.
I've got bags under my eyes, and I'd like to know whether I could use the normal products to remove the bags, or do I have to have surgery?
How old are you now?
I'm 56.
56. Are the bags quite bad?
Yeah, they're quite bad.
You'd have to, come in and have for a consultation with an aesthetic doctor, because what we do these days is not to actually take too much fat out, because that can lead to like a hollowing look in the eye 5 years down the line. But if there's just enough fat and which we can disguise with fillers, and it's quite amazing. We put a little bit of fat all along the tear tuft, and we make the transition from the nose to the eye. So we actually leave the fat bag where it is, but we just disguise or camouflage the fat bag by putting a tiny bit of filler. And you can't believe, it's a quick procedure, if done, by an experienced doctor. And it's quite amazing how it transforms the eyes and takes that tired look away. And that's without having to do any surgery. But depending on how bad the bags are, if they are really bad, then you are going to have to remove those bags.
And let's just say if they're bad and she undergoes what you've just recommended, would that be a once-off, or from time to time she'll have to return to see?
Look, it's normally a once-off, but as I say, with time, over 5 years, you can get a bit of hollowing of the eyes now, if too much fat around the eyes had been taken out. And then you're going to have to come for fillers anyway, or fat transplants to actually, give you that volume loss back again.